Thank you for the opportunity to present our work today on children at high risk for physical abuse. Where do they initially present and what happens next? Child physical abuse, formerly known as non-accidental trauma, is an underrecognized but significant source of pediatric morbidity and mortality. Abused children may have a sentinel initial presentation with minor injuries, followed by more severe injuries in the future. The purpose of the study was to answer the following questions. Among children presenting to Florida emergency departments who are at high risk for physical abuse, abbreviated HRCPA, what type of hospitals do they initially present to? And what influences their risk of emergent readmission within 1 year after their initial presentation? We use the Florida Department of Health Agency for Healthcare Administration database, which contains all emergency department and hospital discharges for the entire state. From 2009 to 2014, looking at patients age 0 to 15. HRCPA was defined based on previously published combinations of ICD-9 codes and age thresholds. We determined the hospital type of initial presentation, and then we evaluated risk factors for 1 year emergent readmission using logistic regression. 33,126 children out of just over 3 million, or 1.06% of the cohort, met HRCPA criteria. Median age was 3 years, just under half were male, and 2.4% had a traumatic brain injury. 71% of these patients initially presented to a community hospital, not a trauma center. 2.5% experienced emergent hospital readmission within 1 year. This table shows the results of our multivariable regression model for risk factors for emergent readmission within 1 year of initial HRCPA presentation. After adjustment for age, sex, traumatic brain injury, and injury severity, we found that the hospital type of initial presentation was significantly associated with a risk for emergent readmission within a year. Pediatric trauma centers had the lowest risk for emergent readmission. In conclusion, most children with high risk for physical abuse in Florida initially present to community hospitals, not to trauma centers. The risk of subsequent emergency readmission within 1 year varies by hospital type and is lowest for pediatric trauma centers. Regional pediatric trauma centers must collaborate with community hospitals and adult trauma centers to ensure that children with high risk for physical abuse are recognized and treated appropriately. Thank you very much for your attention.